My name is Ben Hazen, and I'm a third-year general study resident at Emory University. Today, I'm going to be talking about the incidence of concomitant intra-abdominal organ injury with chance fractures in pediatric and adult populations. I have no financial disclosures. A chance fracture requires significant force to produce a flexion injury to the vertebral body and a traction injury to the posterior elements. As such, concomitant intra-abdominal organ injury has been recognized, although reported associations range significantly. No study has compared the incidence of concomitant abdominal injury with chance fractures between pediatric and adult populations. We performed a retrospective review of pediatric and adult patients with chance fractures at two separate Level 1 pediatric and adult trauma centers in Atlanta, Georgia. Patient demographics, mechanism of injury, injury patterns, and treatments were collected from January 2002 to January 2019. Student t-test analysis were performed to determine statistical significance between the two cohorts. We included 282 subjects, 78 of which were pediatric patients and 204 in the adult cohort. The adult population had a higher incidence of males, while the pediatric group were almost evenly split between the two genders. Motor vehicle accident was the most common mechanism for both groups, but adults suffered significantly more falls, 81 versus 3. The adults had a slightly higher ISS at 19.8 versus 15.6, while spine AIS was similar between both groups at 2.6. Pediatric patients had a significantly higher abdominal AIS at 2.0 compared to 0.79. We first examined the entire cohort regardless of mechanism of injury. We found that adults had significantly more T10 to T12 fractures, while pediatric patients had significantly more L1 to L3. Pediatric patients had significantly more intra-abdominal organ injury than adults, 63% versus 23%, the majority of which were hollow viscous, 40 of 78, or 52%. Interestingly, there was no difference between solid organ injuries between the two cohorts. Of the hollow organ injuries, pediatric patients suffered more duodenal, small bowel, and colonic injuries than adults, although no difference in stomach injuries was found. We then performed a subset analysis for motor vehicle accidents only, as adults suffered from significantly more falls, as previously discussed. Similarly, pediatric patients were significantly more likely to have a concomitant intra-abdominal organ injury than adults, at 67% compared to 30%. Specifically, they were more likely to have a hollow viscous organ injury at 54% compared to 10%. Here is a bar graph depicting the incidence of intra-abdominal organ injury by age. The gold bars represent solid organs, while the black bars represent hollow organs. In conclusion, in the setting of chance fracture after trauma, pediatric patients are more likely to have a concomitant intra-abdominal organ, especially hollow viscous injury, than compared to adults, regardless of the mechanism. Thank you for the opportunity to discuss our findings.